Evening, everybody. Good evening. Welcome, welcome, one and all. Happy Tuesday night. Let me pull up our comments here. Welcome. Thank you for joining. As always, chat is just for members. You can still go over. We do this every week. I think this is number 7 that we've been doing now. If you want to kind of participate, comments in the chat here, join for the membership. As always, though, feel free to go over to the channel community page and you can throw some comments in the post that I made just this morning, and we will get to those questions as well. If I can get a couple of thumbs up here, audio sounds okay. Everything good on the audio front? Get rid of this. There we go. Yep, getting some comments, some thumbs up that things are good. Perfect. All right. We'll give it another minute or two here for some other folks to join in, and then we'll kind of dive into some updates on videos from the week. Perfect. All right. Thank you very much. Appreciate that. All right. Let's hit some updates on. Let's see here. Start a little basketball. Let's start with a little basketball update. Jimmy Butler. All right. So this video went up kind of late last night. If you haven't seen it yet, go check it out, or we'll just talk about it here too. It's funny. I don't know like where this skill of being able to look at these injury mechanisms and have a pretty good sense of what's going on just based on the video. I don't really know where that skill is useful other than what I do on my YouTube channel and trying to teach and provide education about things. But yeah, I mean, this was pretty classic for an ACL injury. In fact, if you just go over to, we're gonna pull up something on Google here that I'm gonna show you. If you just Google like ACL tear position and like mechanism, this pretty much looks exactly like what we saw happen with Jimmy Butler. And so you'll see, let's pull up here. I'm going to open this. Let's grab this picture and we'll pull it up. But yeah, I mean, this position of his knee just dropping inwards, right? Like this is what you're going to see if you look at any image about the position of an ACL tear, right? You see the trunk kind of falling over. We'll talk about how that trunk is leaning over the injured side. You'll see that knee caving inward. The foot is often pointed a little bit out because of the way that the tibia rotates. And it's not so much that this position of this, we call it a dynamic knee valgus, where the knee is kind of falling inwards. It's not so much that that position causes the ACL tear. It's more that like the position that the knee goes into, the subsequent forces are what tears the ACL. So honestly, the ACL, if you were to just ask me like at what point in this whole sequence does the ACL actually tear, right? Because it happens fairly quick. It's not like it's a gradual, slow stretch. Probably intact, still intact, and then like right there. So that phase right as we start to see that collapse inward, right about there is likely when it would have occurred. And you can see him react pretty quickly right away, which is always tough to see. But he almost certainly felt a pop, right? He felt something in his knee. Sometimes players nearby will also hear the pop. And, you know, whenever you feel that pop, whenever they look back at the replay, this is pretty obviously the ACL. So unfortunately, we were correct there. This was confirmed to be an ACL tear. Always interesting. I saw some questions on Twitter last night, or X, sorry, about the time to get an MRI and how he got an MRI right away, right? His MRI was done, I think, literally like right there at their arena. I'm sure, I don't know if it's technically inside their arena or if it's like next door to the arena in their medical facility. At this stage, with as good a quality of an MRI as they have, you don't need to wait for swelling to go down. The ACL, you're going to see it clearly enough no matter how much fluid and swelling is in the knee. And to a certain degree, sometimes that fluid almost acts like a little bit of contrast in there, where if there's some fluid in the joint, it can act like if you inject dye or contrast in the joint. And so sometimes that can actually help a little bit. So I wouldn't be worried about, you know, the urgency. Often in these high-level athletes and just any good quality MRI scanner, if you get an MRI right away, you're going to be able to see these big significant injuries. And so That's nothing that I would be concerned about at all. So now the question is like, when is he going to have surgery? And there's a lot of variety here, right? We saw with Patrick Mahomes that he had his surgery very quickly. That was because he also had an LCL tear, and the LCL needed to be repaired. And so the sooner you can get that LCL repaired back together, the better your outcome's going to be. And so we saw him have surgery really quickly. Somebody else like a Malik Neighbors, who had surgery, I want to say a month, maybe 5 or even 6 weeks after his injury, much more delayed. There was probably time to allow any, significant bone bruising, bone contusion to heal, potentially an MCL sprain to heal before going in for surgery. Often, too, they like to have pretty good range of motion and good strength in the knee before jumping into a surgery. And so, to be determined with Jimmy Butler. The tricky part now, though, about this time of the season is, right, you're planning on a 9 to 12 month return for an ACL tear, and Butler's not necessarily a young pup anymore, and that can certainly affect his recovery. And so, in a sense, every month does matter, right? Because if we're talking about 9 months out, 12 months out, an average 12-month recovery for an NBA player is going to put him back next All-Star break, right? And so if you delay, now you're like a month after All-Star, getting back into your conditioning for the season. It's tough, right? So just trust and know, if you're a Warriors fan, they will get him operated on as quickly as they can to make sure he still has a good outcome, right? You're not waiting to go across the country. You're not waiting to get other opinions and consults. He's going to be by now with the person who's going to fix his ACL, and they'll do it as quickly as they can. But then, yeah, you got to think too, I fully expect this will affect him next year. Not so much because of the surgery itself, but like his return to play. Because it's not just that you return to the court and like you're right away at your peak level. There's been some people, some pretty high level researchers actually. Dr. Tim Hewitt, who's a PhD, has done a ton of research on just biomechanics of ACL tears. He's a big advocate for taking 2 years. He thinks that the duration of full recovery is optimal at 2 years, and that before that you're at higher risk. I don't think we're going to ever get to that point because there's just too much money in the sport. But remember, there's like returning to your sport, and then there's returning to your performance. And whenever you get back to your sport, you're often not at the same level of performance. And so that's what I think is going to affect Butler next year, right? He's older. He's not going to quite have that same level of push. Even if he hadn't injured his ACL, he's probably on the tail end of his career. Add in the ACL injury, I suspect we will see him affected in some way next year if he is able to make it back. And then you've got to hope for the following season. You've got to hope for like the 2026 and a 2027 season being the real, like when he gets back to his former self. So appreciate the super chat. Not trying to be a conspiracy theorist. What are the odds Bo Nix hurt his ankle on the way to the locker room rather than on the field? So let's go talk about Bo Nix a little bit here. I don't think so. I understand though why people are kind of like what in the world is going on here. There is a view, and I'll just quick shout outs. Appreciate y'all joining the membership. Appreciate it. Thank you very much. Feel free, ask comments, questions. I don't care if it's the same person asking 15 questions. I'm here for you all. This is to try to get more conversation and give you all a chance to ask questions, where I'm more engaged than just trying to read YouTube comments. So absolutely go in here and ask some questions. We'll get back to these. Absolutely. So Bo Nix, there's a moment when he's talking with, I'm going to see if I can find this here. There's a moment when he's doing his interview where you can see him actually like standing, and he's not putting weight on that right side. So let me see if I can find the picture that I'm referencing. Bo Nix standing for interview. So it's right after the game ends, and someone took a photo of him from the side when he was giving his interview, and you can see how he's not putting any weight on that leg. So when he actually gives the interview itself right here, right, you can't see his lower body, but there's a photo that someone caught where he's not putting any weight on that right leg. And so, yeah, I mean, seeing that to me is enough concern that this is real. I think, the weird part right about this was just, I put a post on X saying how bizarre all this was, right? Because we've already heard, I think he was supposed to have surgery today, that he already it was literally like an hour and a half of when the report came out about the fracture, that he already had a surgery day with a specific surgeon. So to have an injury that right away within an hour and a half, you have a plan for what you're going to do for surgery, you don't need to do any more testing, no more discussion, means this was a significant injury. Like, this wasn't some borderline thing. There's a lot of stuff in medicine that can be pretty borderline, especially at a time in the postseason where you're going to have a different threshold. to allow guys to get back on the field and play through injuries, right? And so if there's ever a time to try and say, boy, can he play on this? Can he not play on this? This is the time where you're going to try to push that envelope. For something to be so obviously fractured and needing surgery, but yet we not see like a clear and obvious moment on the field is what to me is bizarre. I do think that it was this designed run play when he injured it. And if we look at this view from behind as he's running out, remember it is his right ankle. My best guess is that this is what we call a medial malleolus fracture. We'll look at some example x-rays. Abby, appreciate you joining here. Thank you very much. Talking about Bo Nix at the moment. Put questions, comments in there, and we will absolutely get to them. So if you think about the medial malleolus, let's pull up and look at our anatomy model here, and then we'll get back to the actual play. Let me move this over here. There we go. Shout out BioDigital. Y'all are the best. For real though, go check it out. If you're looking for an anatomy app, it's really good. They make things so much easier on my channel here. So if we zoom in here on this right ankle, let's get rid of a lot of this kind of retinaculum stuff that we don't really care about, don't need to see all these blue tubes, these tendon sheaths. And let's hide the left lower leg, left lower limb. All right. So looking here at the ankle from straight on, the lateral malleolus is the outside bump of your ankle. So that's this part of your ankle. It's actually the lower portion of your fibula. The medial malleolus is the inner bump of your ankle. That's not a separate bone. That's actually the lower part of the tibia, the shin bone, that just has this rounded contour right here. And that contour, that bump, is the medial, meaning inner, malleolus. So lateral, outer, medial, inner. And then the deltoid ligaments all kind of run off of this part of that medial malleolus. Very strong, very robust ligament. What that means is if your foot or your ankle gets twisted in this direction, so everted outwards, kind of mimic on the screen, everted outwards this way, that is going to put extra pull and extra tension on that inner structure, on those deltoid ligaments. What can happen is if you excessively evert and there's a lot of load going through it, those ligaments can pull the bone away from the tibia proper, and that would be an avulsion fracture. So if we go and we look at this play where Nix was hurt, this step where, he's running out to the side, I think it's okay. I think we're okay right there. So as he goes and plants that motion, boy, I wish I could make this a little bit more zoomed in. It's so far away. I think this is like some of the all 22 film. So right there, look at that right ankle. He comes in and boom, that ankle everts. So if we kind of draw it to the side, there's that position right there of that right ankle. That could potentially have put a lot of load pull on those deltoid ligaments and caused a fracture. There's also this second part as he kind of falls to the ground here, where that foot gets awkwardly loaded into the ground, like a little bit of plantar flexion with his foot loaded downwards, but nobody like falls on him. Nobody steps on that right ankle. And so I think, even following this through, still nobody stepped on it. A little bit of a kick there, but not stepping on it. And then he does look like he limps a little bit. He kind of tries to jog in place, like he's testing something out. I didn't see anything on the subsequent, kneel down. So I truly think it was that moment. And my best guess is that this inner part, this medial malleolus, popped off, because that's something you would clearly see it on the x-ray. You'll see this big crack right through there. That's something you're not going to play through. You're going to put a screw across it and be done. The speed at which all this happened, I think, is just because he had a previous relationship almost certainly with that surgeon. So as some of you have commented in here, Nix had previous ankle issues, right? I think he's had previous ankle surgery, and most likely was done by that physician because he was at Auburn. Those docs are down there. The Andrews Sports Medicine, Andrews Institute, kind of all, I think, affiliated with one another. And so he honestly, probably his family, his agent, whoever, had that doc's cell phone number. Doc was probably watching the game, saw it happen, and got a text and said, oh, they sent him a picture of the x-ray, and he said, yeah, I'll see you Tuesday when I'm in the OR and we'll get this done. I wouldn't be surprised about this for next year. I think the question you got to wonder about, like, what were these two previous injuries? And that might influence things a little bit, but without knowing, I think it would be a little bit irresponsible to speculate that wildly with what this could be for his career going forward. This fact about, he broke a bone twice before. I don't really know what to make of that, because we don't know what the break was before. And so without knowing what the break was, right, when someone says they have an ankle fracture, they could literally just have like a little tiny fleck that like popped off the edge of the bone, and that would get read and reported as an ankle fracture. The number of times in clinic that I get a referral and the referral says ankle fracture, and then the person shows up and they've got this tiny little like ditzel of bone that pulled away, that you often just put them in a boot, if that, and there's nothing else you really have to worry about long term. So we don't really know, right, the severity of what these ankle fractures were. At face value, no, I'm not going to be worried about it long term. If we get more information, then sure, maybe we think about it differently. So no, I guess to get back to this question, I don't think there's anything that would make me like overly, suspicious. Yeah, Chase Center right across the street from the hospital. Yeah, a lot of these teams have like sports medicine clinics kind of attached to the arena, and so they've usually got an MRI right there. Let's get through. Let's see. Let me make sure. We had a couple of new members join. I have not asked this at any point. I will try, like I always try, to address all questions. If anybody is telling you that they have evidence on this, they are lying, because I've done lit reviews and searches on it, and there is, I think, very minimal to no human data on peptides. So BPC 157 peptides. I honestly don't know about TB 500. I'll admit to you, like I'm probably not the definitive person. I know that I'm not the definitive person to ask about peptides. I've looked into them myself. Actually, I'm trying to research them myself because my shoulder is injured. I think I've got a rotator cuff injury. And so I'm reading about it more. I'm trying to explore it more and think about it all for myself. I think number one, right, you've got to be careful because the suppliers can be kind of sketchy and all over the place. But there is no data whatsoever for use of this after hip replacement. So I think talk to people in the field who have experience with it for something else, right? More Plates, More Dates on YouTube. Derek, I think he's extremely educated with pharmacology and some of this stuff. Check out he might have something about peptides that would be more reliable. So no, unfortunately, I can't give you a specific answer on that. If I followed along with Gabe Landeskog's return after 3 years, a little bit. Yeah, I saw, didn't he had like another injury to his knee, but then things checked out okay and he came back fairly quickly. I'll tell you, like the hard part with hockey, I've talked about this before, but hockey is really hard because there's just so limited detail. And, like Jimmy Butler, perfect example, right? We're talking about Jimmy Butler and how we can look at these injuries and we can say like, hey, here's what the joint did. Here's the position of the limb. With hockey, you can't see that very well. You can't see the positions of the limbs. And so you have a much harder time trying to make these predictions. And then oftentimes we don't get a lot of great information as follow-up. And so I'm going to see if I can find anything quick that might prompt me to be able to answer some questions for you. But it's really hard. It's the same with baseball, right? When you're watching a baseball replay, you don't see a lot of joint movement, right? There's no clear movement of things. Oh, that's right. He like slammed into that's what it was. He slammed into the post. So yeah, I remember following that. Let me see if I've got, I think I might still have the actual injury video that we can look at. Now it's ringing some bells for me. Where he basically just, yeah, he slammed into the side of the post. I can't find it right off the bat. I would still be optimistic, hopefully, for the Olympics. I think he's, the report is that he's still week to week. Rehab is going okay. The injury looked very much like a rib injury, right? He like slid into the net and then the post kind of hit his upper ribs. A lot of times for rib fracture, there's nothing you do other than pain management. And so as soon as the pain gets under better control, you can go play. They might be intentionally, right, with as good as the Avalanche are doing, they might be intentionally slow playing this to try to have him in as good a shape as possible for the Olympics and not take a chance that something comes back, he comes back too soon and like gets re-injured and misses the Olympics. So that wouldn't surprise me at all. If they're kind of slow playing his recovery, the Avalanche are doing so well, why put him out there and risk things at partial percentage? When I'm sure the Olympics is like a huge personal goal for him. Second year PT student. Awesome. Congratulations. Great field. Rely on you all a lot. In terms of recovery and rehab for a case like Bo, is there any specific metrics you'd like to see hit or specific outcome measures before return to sport? Yeah, great question. Honestly, you would know more than me probably as a PT student. The general things that you would care about, right? Like we talk about range of motion, we talk about strength. It depends on what you're doing. If somebody is just having a simple screw put in to put a bone back together and you're not reconstructing ligaments, you're not doing any tendon transfers, you're not doing any tendon repair, there's really not too much you got to worry about. Like once you get past the phase of worried about like infections, making sure there's no nerve damage, no blood vessel damage. If you're just doing a simple fracture, like put a screw in it and be done, he should have an amazing recovery. Like you're not disturbing enough of the tissue. You're not causing trauma to the muscles, the tendons. The muscles, the tendons, the ligaments, those are the things that have bigger, long recovery times, right? An ACL tear, you are absolutely going to be measuring hamstring strength, quad strength, these biodex machines, trying to measure objectively and see percentages side to side, make sure you have symmetry. For an injury that's just a simple, hey, like you're going to be walking on it in maybe 4 to 6 weeks, not as big of a deal. And so really it depends on him, on what specifically they had to do. If it was just a simple fracture, no other tendon, cartilage, stuff like that, I really wouldn't be worried much about these. I think just as part of his natural training, he's going to get back to really good symmetry. You know, you're going to start working in your proprioceptive strength, the things you would do for an ankle sprain. But there's no specific outcome measure that I would use, right? You've got all these like the dash scores and whatnot. I would not be worried about those. Let's see. Yeah, nothing that I saw with UCSF. Yeah, UCSF is really good. I'm gonna give a shout out. Actually, speaking of UCSF and them, let me find. If you're all are looking for somebody who is a little bit more active, plugged in with the Warriors UCSF folks, Dr. Pandya on X, fantastic. Does kind of stuff similar to what I do, but very heavy focused on Golden State. I think he's an orthopedic surgeon at UCSF. I don't think he works with the Warriors at all, but does a lot of really good stuff. So good follow if you want to get some more specific Warrior stuff. He's a great guy. Really, really like him. Okay, let's get to some other questions here. Yeah, Derek, more plates, more dates. Funny story. If you all right, this is quick little sidetrack, but I think you all will appreciate this. There are a few things in my YouTube history. More plates, more dates. Derek roasted me. If you all don't know about, yeah, here we go. All right. Yeah, look at this. So if you guys don't know, more plates, more dates, Derek. I don't really actually know like what his formal training is, but like brilliant when it comes to like pharmacology and bodybuilding and all that sort of stuff. And so a number of years ago, yeah, this was 5 years ago, I made a video about Israel Adesanya. Sorry, let's go back. And was talking about UFC fighter Israel Adesanya, and he had what looked like pretty clear like gynecomastia. And I overstepped a little bit. It was a little bit out of my expertise area. And the video that I made about it went crazy, like #1 on YouTube, trending, and like got millions of views. And Derek made a video on it that didn't do very well and was understandably like, what the heck? I mean, he's very much an expert on this kind of stuff. And here I am kind of like, in a sense, a little bit like firing from the hip. There was a lot of lessons I've learned along the way about stuff that's really in my wheelhouse to cover and talk about. And there were times where I kind of strayed out to the side. This was definitely one of those in hindsight. And so Derek like kind of called me out about it. We kind of had it out and we're good now. He's not like a friend or anything, but I thought this was funny, right? My good old face on his YouTube video, "Doctor is wrong," was pretty funny. So anyways, little random sidetrack. Okay, let's get back to what we were talking about before. So yeah, he's good stuff. Go check out his videos. Welcome. Yeah, let me get to your question here. Appreciate you joining. Mechanism of a deltoid ligament tear, why it takes so long to heal. Tore mine recently playing soccer. It's a really big, broad ligament, and it's a really strong, like crucial ligament. So if we look at the, let's go back and kind of highlight the structure and stuff of the deltoid ligament complex. So ligaments of the ankle, deltoid ligament. So when you look at, and we're going to actually let me get rid of our bone anatomy. I appreciate y'all's patience when I go through and do this because it's too hard to save all the, individual skeletal bones of left lower limb. There we go. Okay, so if we look at the deltoid, there are individual components to the deltoid ligament, but really you kind of got to think about it as like one big ligament. And that's the only real ligament that's stabilizing the medial part of the joint. On the outer ankle, the lateral ligaments are a lot more defined, like individual ones that are more easily repairable, right? It's more on the lateral structure, like taking a rope and cutting the rope. On the deltoid complex, it's more of like taking this broad-based tissue and like slicing through it. And so it's just, I think if you talk to a surgeon, I think it's a lot more complicated to fix, depending on reconstruction, repair. It has to be a lot stronger to maintain that medial stability. I'm not sure, to be honest, about like blood flow, right? We talk about blood flow a lot in terms of how that's going to affect healing. So I think more so of it just like being a more complex anatomic structure. And when you're trying to recreate an anatomic structure, the more complex that structure is, the harder it's going to be to recreate. Is kind of a simple way to think of it, right? And Achilles is just a big rope, right? It's pretty simple to like fix a rope. Something like an ACL that's got more rotational forces to it, it's kind of at an angle, smaller, more complex kinematics with it, is going to be more difficult. So that's kind of, I think, the reason why I would say that it's different. Let's make sure we're getting through the rest of these here. Cut leg, then quad wasn't firing. Let's see. Yes, Abby, we're gonna get to this. This is on my list to cover. So we will get to this. Yeah, awesome, Michael. Yeah, so if I've addressed Michael Porter Jr. in the AFO brace he wears during games for foot drop, can you explain what foot drop is? Absolutely. Let me give a quick little shout here. Let's go back to, because if you want to watch Michael Porter Jr., I've got a video. This video is probably, goodness, 6 years old. Man, look at that old thumbnail. I've actually done a couple, looks like. Yeah, so I talked about his foot drop here in this video. So if you want to go back and like watch something that's longer, feel free, back in the older studio days. But essentially, foot drop is a description meaning that there is weakness in the dorsiflexion muscles of the ankle. So the ankle, when you pick your toes up, that's dorsiflexion, pointing the toes down, plantar flexion. The Achilles, the gastroc, points the foot down, plantar flexion. The muscles in the front of the ankle, specifically there's 3 of them. The anterior tibialis is the main one. That lifts the toes up. So whenever you're walking, your anterior tibialis, your anterior compartment muscles, have to fire to pick your toe up so that when you swing your leg through, you don't catch your toe on the ground. Foot drop means that you have some cause of weakness in those ankle dorsiflexors, and so your foot literally like just drops to the ground, right? We're not very good at coming up with names for stuff. So it's just literally the foot drops because it's weak. It can be weak because you've got a rupture of one of the tendons, right? You can rupture your anterior tibialis, you can't pick your foot up, no connection there, it's weak, foot drop. The more common is that it's weak because of nerve damage. So if the nerves are damaged, supplying those muscles that pick the foot up, the nerves can't fire, your foot's weak, your foot drops. In the case of MPJ, he's been very open, right? He's had multiple back surgeries. He's had a lot of back issues, especially when he was back at Missouri and then early in his career. He's been very open about all this. But his is nerve weakness, nerve damage from his previous back issues. And it's like so inspiring. I wish this was a bigger story, because if you ever have like worn one of these just for fun, I don't know why you would, but these things are usually carbon fiber. Sometimes people wear plastic ones. This is like not simple and easy to just get used to running and playing high level basketball in. And so the fact that he not only is able to do this with having foot drop, but also do it with the brace on is extremely impressive. Like, mad shout out to him, super inspiring. If I've got, athletes dealing with something like this, young folks dealing with something like this, I bring it up to them. There was also a Notre Dame linebacker who played for the Cowboys. Can't remember his name, Jalen something, who was another famous case of having foot drop and wearing an AFO, an ankle foot orthosis. So AFO is ankle foot orthosis. I want to say Jalen something. Maybe somebody will remember it and put his name in the comments here. So another example in football. Yeah, so really, really cool to see those things. Let's see. Other new. Is it possible to spend a career as an elite pitcher or golfer, for example, and not kind of destroy your shoulder or back? Yeah, that's let's think about that. So let's talk about the golfing one first. Yeah, I think definitely a golfer. Like, you can be an elite golfer and not destroy your back at all. I will say, this is kind of anecdotal, but we've seen this rash of UCL elbow injuries in young pitchers, right? Because there's this huge push for speed. kids are trying to throw harder, faster, longer, etc. And we're seeing a lot of increase in Tommy John surgeries, right? The ulnar collateral ligament on the inside of the elbow. The more you throw, a very clear risk factor, more velocity, more pitches, etc., more workload, higher risk of injuries. I think that like chasing ball speed in golf is going to be equivalent with back injuries as pitching velocity is with UCL injuries in the elbow. I haven't seen like data to suggest that, but I'm concerned that that could be happening. Guys are just trying to chase ball speed, right? Swing as hard as possible, as fast as possible, and you get a lot of guys who at a young age have really awkward mechanics. Michael Lasasso, who just signed with one of the live teams today, like super goofy, like arch in his back. Will Zalatoris dealing with it, and I think we're going to see more back injuries in younger golfers. Yes, I do. Now, they're not all like that, right? I mean, Scotty Scheffler, Rory McIlroy. There are tons of examples of very high-level golfers who have good mechanics, good form. They're not putting their back under excessive stress. So I think you can do it in a good, healthy way, but I'm worried we're going to see more of it in young athletes. Pitchers, man, I would be hard-pressed to find a former elite high-level pitcher who doesn't have some degree of shoulder discomfort. Right now, is it to the point where you've got like a full-blown rotator cuff tear, a full-blown labrum tear? No, not necessarily, but some degree of shoulder pain, right? I mean, a lot of them, your shoulder is not designed to throw fastballs, right? Your elbow is not designed to throw fastballs. When we're doing this, you are putting your joints under more load than they're designed to handle. Some bodies handle that better than others, but it still is more load than it was designed to withstand. And so I think you're going to have to assume you're going to have some degree of attritional wear. You're going to have some degree of tissue breakdown because the body is not designed to do that. We're pushing it beyond what it was designed to do. And in some cases, we push it successfully, right, where we tolerate that kind of overload level, but never to the point where it's a significant injury. In some cases, we push it too far and we end up with a big traumatic injury. So I think in baseball, I'd be much more hard-pressed to find an elite athlete without shoulder issues in baseball. Yeah. Jalen Smith. Thank you. Good shout, Steven. Appreciate that. Yeah, Jalen Smith, another good example of a player who dealt with those injuries. Yeah, absolutely. Go check out a lot of stuff. I'll tell you, there's a lot of stuff on the channel that I've covered that people ask about that if you just go Google and search, right? I've been making these videos for 7 years now. There's a lot of stuff on the channel that you'll find if you go search historical injuries. So always go check those out. The L4 myotome. Yeah, shout out to the L4-L5 myotome. What this means, so myotomes are like muscle distributions of nerves. So the nerves coming out of your spine, the L4 nerve exiting at the L4 level, L5 nerve, etc., down to the S1 nerves, and then those nerves go off and innervate the muscles. And so the L4 nerve root is the spinal root that's responsible for the majority of your ankle dorsiflexion. It can also be some L5. There's a lot of L5, but anywhere along that whole pathway. So it can be L4, L5 up in the back. It can be lumbar plexus. It can be sciatic nerve. It can be common peroneal nerve, and so on. So you've got to think about the whole level. But yeah, L4 myotome, good old L4, L5 myotome. Yeah, but anterior tibialis is typically the muscle that we would do for EMGs if we were trying to pick out like a distal L4 muscle. Proximal L4, L5 gets more into like glute tensor fasciolata. IPR, it's really exciting. Inpatient rehab, yeah, I see a patient walking with a new AFO. Yeah, can't imagine playing pro basketball. I can't either. I mean, right, a lot of the ones that the patients in the inpatient rehab facilities are wearing aren't like fancy carbon fiber ones, right? They're, they're like the polycarbonate plastic ones that aren't going to be as comfortable. Some of these carbon fiber ones are pretty slim and pretty sleek. And so I think it's definitely easier in these carbon fiber ones that the elite athletes are wearing. And honestly, not even just elite athletes. Like they're just expensive, right? And so if you're a college athlete, high school athlete, weekend warrior, you can still get a carbon fiber one and do pretty well. So yeah, it's really cool. There's some powered ones now. I think like Nike or some foot companies coming out, or shoe companies coming out with like a powered, like kind of AFO type of brace. I don't know. Knuckleball pitchers are fine. Yeah, they don't count. They're not throwing hard enough, right? Yeah, good point. Yeah, the back issues with Tiger, 100%, right? I mean, he's swinging hard, right? You're swinging so hard, and now he's seeing all these injuries kind of starting to catch up. Like, you got to remember with all these athletes, like bodies are not designed to play professional sports at this level, right? I mean, there's some that are lower risk than others, but like gymnastics, right? I mean, our gymnastics is such a rough sport. Like the body is not designed to flip through the air and do repetitive bending and twisting and loading of the spine year after year after year after year. And you're going to see these things. The human shoulder, the human elbow is not designed to throw 60, 95 mile an hour pitches every fifth day for 10 years. Knees are not necessarily meant to like pack on 350 pounds and play NFL level football for 17 weeks a year for 15 years. So yes, but that's the risk with any of those sports, right? I mean, to some degree, you're pushing it, you're doing it because you're passionate about it, but there are going to be those inherent risks that if things are not done the proper way, yes, absolutely can see these injuries. I have not covered here. I get done talking about request any video or go back and look at old videos. I have not talked about Vince McMahon. Wrestling's another one, right? I don't know really how to cover it all the time because in the moment, bad looking stuff happens, but you don't know if it's real or not. And so the last thing I want to do is look like a doofus covering this like, oh my goodness, you know, cervical spine injury. And like in reality, it was just part of the show, right? The historic ones, yeah, would be interesting. So no, I have not covered him. Quick story with how I started this channel. So if you go back and you search, let's see, we're going to look at a couple things. So, goodness, Markelle Fultz, I just had a brain fart. Markelle Fultz's injury. So Markelle Fultz and my name, I remember very specifically. So I made YouTube videos for about a year where I was talking about just my life as a resident, going through residency training, and always wanted to do the sports medicine angle because nobody was doing it really at the time. There were some people doing like written blogs with it, but nobody was really doing the online video content. And I thought like, this is cool. Like I like sports. I like teaching stuff, cool opportunity to get people learning. I remember hearing the news about Markelle Fultz being diagnosed with thoracic outlet syndrome and thought like, perfect example. Yeah, look at that. Look at that hair. Goodness sakes. I still very clearly like remember this beige wall in one of the spare bedrooms of our apartment during residency, and like I had these homemade lights. Yeah, it's cool. That's fun to look back on and think about, right? We had the graphics that we pulled up. So I made this video and it like blew up. I mean, like 50,000 views in a day compared to getting like 500 on my previous videos. And so I saw that people loved it, and people loved it. I like doing it, and the rest is history. That's all we did from there on was talk about the sports videos. I like creating. I like sharing things. I like having other outlets beyond just medicine. And so the YouTube channel gives me an opportunity to create content and have like a different thing that I'm learning about and passionate about. All right, we are moving through all these. Let me see, make sure we're not missing any other members that are joining here. Yeah, all right. Big Quiet fan, it can be rough. Yeah, latest knee injury is a left knee contusion. He was sent back for more treatment. How concerned should I be? Yeah, so a knee contusion. A couple of things to think about with that. One possibility, if they're being truthful, is that literally it's just a bruise, like somebody bumped his knee and his knee hurts. Nothing to be concerned about. The other thing that you got to be careful of is a knee contusion can sometimes be just a very like non-specific, his knee hurts and we don't really have a great like specific injury reason why, it just hurts. That makes me a little bit more concerned, right? Sometimes you'll hear them use contusion, knee strain, when it's more just like chronic stuff that's acting up and bothering him. And so that's a little bit harder to predict. So it's tough. Like it's really hard to know, like, can you take them at their word, or are they just kind of being vague for the sake of like, hey, we don't really need to give any more information. So, yeah, I was watching the football game last night. Yeah. Some of the Mendoza hits like looked a little bit concerning. I didn't see anything that clearly was like posturing or stumble, those sorts of things. But yeah, he took some serious hits, like the non-targeting call when he got hit in the helmet, the run. It did look, I think, are you talking about on the sideline? They really like quickly, it looked like he ran over to the sideline and someone collapsed. Someone collapsed on the IU sideline. And I thought too in the moment that it was Mendoza, but then they never went back and showed him. The next time they showed the sideline, he was like walking to the bench to get ready to sit down. If anything, I would have been more worried about like a chest trauma or like a abdominal trauma because of how he got hit. But Yeah, okay, it was. I might have to go back and look at that. I thought that was really strange too, because it clearly looked like somebody on the Indiana sideline collapsed, like after talking to Signetti. And I thought for a second, like, was that Mendoza? And I kind of was getting ready, like, hey, is something happening here? Do we need to go make a video? And then they just didn't mention it at all. So I don't know. He seemed okay after the game, right? He seemed okay the rest of the game. But yeah, I caught that. Good eye. The rules. I don't know what did I change? Yeah, I was on the sideline. Yeah, I do age. If you go back and look at those, I definitely age. My hair is holding up nice though. We're starting to get some more grays. All right. That's funny you recognize those old videos. So clearly I do age because somebody didn't recognize my old videos. They just they didn't something until a year or two ago. Yeah. Very different, right? We used to have just the plain wall that we would stand in front of and talk about. It took me like 10 hours to make a video at the beginning. And now I think the quickest, I think I had Kittles up within like 22 minutes. So yeah, you just do the same repeated things and it gets a lot easier. Keenan Allen, his crazy shoulders. Yeah. Romo, consistent back injuries. Yeah, I don't really know if golfing was the cause or not. It could have been right. I mean, I think honestly, some of the stuff with LeBron James at the beginning of the season could have been irritated because of golf, right? Like golf is definitely something that can cause some sciatica, cause some irritation. And especially when you're starting out playing and you don't have really good mechanics, I think golf might have been part of why LeBron had some issues. Yeah, okay, so multiple people saw it. We'll have to go back and I'll have to look at that again because they're like definitely, yeah, they cut away at a pretty quick moment. For those that are just not following or just tuning in, we're talking about Mendoza. Like after he got hit on that 4th down conversion, he collapsed on the sidelines when he got off the field. He didn't seem affected the rest of the game, but yeah, there was definitely something odd going on there, but I don't know. No networks have reached out to me. I'll be totally honest. Yeah, I have like occasionally some like random local radio affiliate will reach out and be like, hey, can we like come to you with stuff? But no, like none of them. ESPN, NBC, The Ringer, like none of these organizations. I have some contacts with people at those organizations, but nobody in my 7 years of doing this has ever reached out in any formal capacity and said like, hey, can you be like our injury correspondent, injury analyst? Can we run things by you? Nobody has. I got really upset about it early on and thought like, well, why not? Like, why don't they want to learn more? And now it just is what it is. Just kind of accept it and move on. Yeah, I think too, if an expert comes on to talk about something, it removes their ability to speculate. And a lot of these sports shows, speculating is what drives views and clicks, right? If you can sit there like when the whole Tua stuff was happening with his concussions, like it's a better TV show if you can have a bunch of former players and people who don't know any better, like speculating back and forth about concussions. Oh, you should do this or you should do that, or I don't think he was, or I think he was. As soon as you bring on an expert, like you can't speculate and argue about it anymore. And so I think sometimes they just don't like, it gives them almost less content to a degree if they can sit there and just like make stuff up all day and have additional stories. But you'd think that, I mean, ESPN has a injury correspondent, Stefania Bell. She does a lot of fantasy sports stuff for them. She's a physical therapist who I think does a pretty decent job. So they at least have somebody that they'll reach out to. But yeah, nobody else. Scrubs, yeah. I quit watching Scrubs at the very end. The Pit's my current go-to show. Love The Pit. Professional athletes were getting carpal tunnel syndrome from Guitar Hero. That's funny. I don't remember that, but yeah, that would make sense. Yeah, so this is exactly what I mean. Like I love Bill Simmons' stuff. I love I've talked a lot with Kevin O'Connor back when he was at the Ringer, Jake Kyle Mann. Like these are people that I text with and we'll talk about injuries with, or they'll message me and be like, "Hey, what'd you see?" I think they've referenced on Bill Simmons' podcast a number of years ago some of my stuff, and I was talking about Zion. But like I'd love to do something like that and kind of be a regular, to go down stuff. But yeah, there's that conspiracy part that they wanna speculate. They wanna have the ability to just kind of BS a little bit about stuff. And if you bring on an expert, it kind of removes that opportunity. And so yeah, it is what it is. I'm good though. This is why I want to expand this audience more though, is to have more reach over here. Yeah, it's kind of like the rules experts, right? Sometimes it would be tough, right? Someone like something terrible happens, but a situation like Damar Hamlin, right? When Damar Hamlin went down, I think actually it would be helpful to have somebody who can kind of, you know, in a calm, controlled way, trying to be professional like I do, going through some of that. And so, yeah, I don't know. Stephen A. his opinions over. Yeah. It would be kind of funny. Yeah, he's referenced me in, yeah, they've talked about my stuff. I think Brian Sutterer talked about some stuff a little bit. Yeah, I mean, I agree. Like, you'd think that having somebody to go through and kind of, you know, edit, right? You know, when someone's writing an article about medical stuff, and like, why wouldn't you talk to a medical expert like before you start writing all this medical stuff? To me, it seems so crazy. And I'm very accessible. Like, it's not hard to get a hold of me, and I respond to stuff. So I don't know. It's okay. I appreciate you all support thinking that would be a good thing to do. Yeah, Sanjay Gupta is kind of who I try to model my stuff after. Is kind of like what he does. That's how I described it to my family. Okay. Let's see. The pit's great. I love the pit. All right, let's go to some of our, in the meantime here, yeah, we got 10, 15 minutes left. Keep putting any comments in the chat. We're going to go flip over now to the YouTube channel page and see what we've got to discuss over here. Let me zoom in and make this a little bit bigger so that everybody can see things okay. All right. All right. How did Zach Charbonnet tear his ACL? Did the helmet-to-helmet contact cause him to temporarily lose consciousness, and therefore his knee buckle seemed like such an innocuous play? Yeah, I was wrong on this one. I had a X reply to somebody that I was more optimistic that hopefully it wasn't his ACL. If we pull here, I've got the play here because I saw this as one of the comments. You know, we think about what happened with Jimmy Butler, where we saw Jimmy Butler and, you know, the position of his body. For Charbonnet here, as he's running in, so this was his left knee, and we're okay, and then right there. So that plant of his left leg, why I was more optimistic here was that his trunk, there was no trunk lean. Like, usually you see the trunk leaning over that injured side when it's a non-contact. And so in this position, he's already in a vulnerable position. And then as it continues, his knee is already falling into a bad spot. I do think it's possible. That's actually a pretty good point about, like, could the head contact have played any role in this? If we look at it through, though, boy, I think his knee was already in a compromised position before he would have had any effects from the head. Now, yeah, certainly if you get like hit in the head, that's going to disrupt your neuromuscular control. It's going to disrupt that feedback your brain is getting from the knees and sending back down. So that's a good point. That's a really good thought about how potentially some of that helmet to helmet could have played a little bit in a role in this. So yeah, one where I thought looking at it that it seemed pretty benign, but unfortunately ended up being not good at all. ACLs and MCLs get all the attention. I know, right? They're the popular ligaments. What are the most common ways in sports to injure the PCL or the LCL? PCL, 100% Connor McDavid. So let's pull this up here. Oh, it's so nice. I'm so glad I put the time in to find these, or to keep track of these old injury videos. So this was Connor McDavid a number of years ago, right? The PCL, dashboard injuries, so car accidents where someone's knee hits the dashboard, is the most common time that you will see a PCL tear. Here we go. And so what we saw with McDavid, right, as he goes sliding in here, his shin just strikes directly onto the post. And so that shin running into the post of the net pushes his tibia backwards. And so that's going to be similar, right, to slamming into a dashboard. So as he goes in, boom, that tibia is pushing backwards. The PCL is trying to resist that posterior motion. And so because of that excessive external load pushing posterior, causes the PCL to tear. So in hockey, you'll see it this way. When someone runs into the net. In football, right, Christian McCaffrey a number of years ago, when someone just falls directly on their knee, falling directly on your knee can cause enough force upwards to direct that tibia backwards. Usually in football, if they're like that, they're not like full-blown surgical. And even most of the time, PCLs are not surgical. So that's typically what you will see with those. Still keep an eye on the comments over here. Yeah, MMA. I used to cover a lot of MMA, but then I don't know. Not as much interest in the sport. I'll definitely be watching this weekend though, and if something happens, we'll still cover the bigger fights. Stephen Adams, grade 3 ankle sprain, basically a fracture when it comes to recovery time. It's not a bad way to think about it. I mean, a grade 3 meaning complete tear of those ligaments. Yeah, you're talking about usually like a 6-week, maybe even a 2-month recovery. And often, yeah, fracture can be similar to that. So I've never actually thought about that. That's a good way to maybe think about these, is that a grade 3 sprain can almost be treated like a fracture. The difference is that with a sprain, you're going to do more early, like rehab movement, etc., versus a fracture, you're going to mobilize longer. And so with an ankle sprain, you're doing more early rehab. With a fracture, you really haven't injured the ankle, so there's probably going to be more stability. Given the choice of the two, assuming it's like a simple, stable fracture, I'd probably rather fracture my ankle. Than have to deal with the proprioceptive defects and issues with an ankle sprain. Yeah, good question. Best prospect? Yeah, I don't know. You don't want to just talk college ball with me. I don't follow enough college football to know about that. Delayed timeline for neighbor's recovery? Yeah, so far not really. These early stages, no, right? There's a lot of different stuff with what could have had to be done in surgery, etc. The only time I start to get worried is if we're getting senses from these athletes that they're not taking their rehab serious, right? If you're starting to see them like doing stuff that you wonder like, what are you doing? Or you're getting like whispers from beat writers and stuff of like, concerns about commitment, dedication, etc. That's when I start to get more worried about this kind of stage of the rehab. But I have no idea with neighbors. No speculation there. Yeah, shout out to my alma mater, Indiana. Yeah, I went to medical school, sitting up there. I went to medical school at IU, Indiana University. So I was never there as like a sports fan. I actually grew up a Kentucky basketball fan. I lived in Lexington for a while. And so I actually like IU basketball is like my mortal sports enemy. But yeah, it's cool. It's really cool to have that kind of connection and see them do well because, yeah, I mean, who the heck would have thought? Goodness. If you could have placed a bet with somebody, after they won their last college basketball national title, that they'd win a football national championship before another basketball national championship, crazy. Proximal hamstring tendinopathy, close to the lower butt and top of the hamstring, pain increase with sitting. Yes, that's a thing. I don't know what the question is there. Mom felt a deep pot. Yeah, like I said, I'm gonna stay away from individual medical advice. Sorry. Will it be feasible to pursue my dream of general surgery, strictly following proper surgical economics, reduce the burden on my shoulders, and will I have a long bilateral shoulder instability with the right shoulder operated on? Yeah, again, this is getting into like personal stuff. Good recovery, good treatment. Like, no, it shouldn't be any issue. If you've got like ongoing long-term issues with stability and pain, etc., yeah, like surgery is a physically demanding field, and so I think if you've got like lingering joint problems, you might have some residual pain, but get good treatment, trust your treatment, take care of things, and do what you can there. I mean, there's people with like, there's some surgeons out there that are like in wheelchairs, right? And they actually like use medical like assistive devices to help them stand up in surgery and like operate and such. So yeah, I mean, there's pretty impressive things you can do with disabilities in medicine. Yeah, this is a really open-ended question. We're gonna skip that. Sorry. Yeah, back to the hip thing. Sorry. Sportsmen in high school. Let's see. Teachers said football is the most injury-prone sport because they use so much equipment. Collarbone injury is the most common football injury. Yeah, I don't think so. No, collarbone injury is not going to be the most common injury that you see in football. In fact, I'm trying to think of any clavicle fractures that we heard about this past year. I'm sure some happened. We just didn't hear about it. Titans wide receiver Treylon Burks. Did he have a clavicle? I think he maybe had a clavicle fracture. No, we definitely don't see as many clavicle fractures as we did before. Why do certain injuries in one player's career? We're still keeping an eye on the chat, so if people still have chat questions, still put them over there. Certain players injuries in one player's career, but not another. D Rose's ACL. All right. So to answer this question, you have to remember that there's often more that happens than just the ACL. So there is often, meniscus injuries. There can be cartilage damage. There can be posterolateral corner, PCL, MCL, LCL. There can be other stuff than just an isolated ACL that gets fixed. But we only hear about the ACL, right? Because that's the big sexy thing to talk about. And so number one, you can't equate one player's ACL to another player's ACL because there is a lot of other stuff that might have to be done in surgery between the two of them. So that's point number one. If you say that they are equivalent, let's say both of them pure isolated ACL, nothing else. Players' genetics, right? You're going to have different tissue laxity. They're going to rehab differently. Depending on your position and your skill level, some players rely on different traits of their muscles, their joints, their ligaments than others. A lineman who's not doing a lot of cutting and pivoting probably going to do better after an ACL than somebody who's like a quick, speedy point guard who relies on quick change of direction and explosive ability. When these athletes are operating at that 99.9 percentile of athleticism, an injury could be like throwing a grain of sand into the gears, right? It might not affect me that much because I'm not at that level. But when you're already having to go through so many layers of physical fitness selection to like get to that level, the smallest little thing can be what makes or breaks that fine range of being at that level of sport. And so there's a lot of factors that go into it. It's really hard to equate one to the other. Will he return? Yeah, he'll return. You got to remember too, like these athletes that have all, the skill level, the notoriety of a Jimmy Butler, like, of course you have to assume he's going to return. The question is like, is he going to return to his previous performance? And that's what you have to consider the age now. Like you assume he will, you rehab him like he will, but you maybe plan, right? If he's on the trade market and you're a team picking him up, you plan and think like, maybe we have to be prepared for the possibility he's not quite the entire player that he was before. Why do NFL teams have players back a week or two max from concussions, but literally every other sport has people out for months, such as MMA? This all depends on the return to sport protocol. So MMA, right? There's a lot more trauma. It is. I mean, they're very like strict on time off for concussions because I think they really want to do more to protect their athletes. They don't want them sparring. They don't want them doing anything when they're coming off of a knockout. I have no issues with that. Football and all other sports like, basketball, very similar, high school sports, very similar. You've got a return to play protocol. And all the research has suggested that if you can progress through those 5 stages of the return to play protocol and you're symptom free and we gradually ramp you up, that you're good to go. I do think it's a little bit ironic that the return to play protocol so conveniently allows a player to get back in a week because, right, football dominates a lot of culture. And I think we'd have to be realistic that is potentially some influence, right? That if you can get a football player back the following week, let's have a protocol that allows that possibility. I think that's good because a lot of them probably are safe to go back in a week. I don't think necessarily our high school kids are safe to go back in a week. I think we'll probably eventually see like a mandated maybe 2-week recovery period after a younger like pediatric youth concussion. So more to come, I'm sure, on that. Let's see. Last one. Craig Woodson should have taken another game after the big hit during the interception. They clearly exhibit concussion systems afterwards, but the nickel staff cleared him and played 2 snaps later. Yeah, there were a ton of like really big hits, head injury checks during NFL this past week. There's some that are very obvious, right, where they're clearly motionless, they posture, etc. Sometimes too, it's hard, like if the broadcast just moves past it right away, like they don't even show a replay or they don't make a comment to it. Sometimes we miss it. And so, yeah, I don't know specifically enough recall on Craig Woodson's to look back. Yeah, so I think they're doing the best they can. And unless we see something clear and obvious, I think it's hard to be too judgmental with them. Right. They don't always have, they are reviewing replay. The spotters are and such. But we're like looking to critique, to a certain point. So I think those things, hopefully he's doing well and okay now. All right. That is it on the community post. Anything else? Got any other questions? I think we've answered. Yeah, I got through all the super chats here. Helps players not necessarily hide their symptoms. It was just given they would miss it the next week, they could lie. Yeah, I think it's hard. I think we're gonna just, as long as they keep trying to learn more and look at it, does seem like the recovery time has been longer recently. It seems like more guys miss 2 weeks, and you'll even hear sports commentators like Bill Simmons. We were talking about him earlier. You'll hear him say like, "Oh, it's, concussion, kind of a 2-week thing now." That does seem to be the case. It does seem like in the regular season, players are missing closer to 2 weeks now. All right, we got anything else? Any other questions? Right at about an hour. No. All right. Cool. I'm going to turn in. Hopefully nothing else happens tonight so I can get an early night's sleep. Get to work tomorrow. All right. Thanks, everybody. Appreciate y'all as always. Thank you very much. Really love and appreciate you all's support. Enjoy doing this every week, and we're gonna keep it going. So really appreciate y'all. Again, that Discord's still up for the channel members. I occasionally do get some questions over there, and we'll see. It's not taken off as much as I would have hoped or liked. Oh yeah, Abby Kittle. Yeah, sorry. Thanks. Thank you for reminding me. Yeah, let's talk about this. So Kittle made a comment. Yeah, appreciate. Thanks. Have a nice night. We're gonna. I mentioned I would get to this, and I forgot. So thank you for reminding me. Sorry, I forgot so long. So Kittle made a comment about how his Achilles was like best case scenario, how it occurred higher up in the calf, and he was like really thankful and positive. So let's pull this up, and we will talk about this. Let's go back to the calcaneal tendon muscular system. Here we go, connective tissue. All right, we are just trying to get everything here. Let me, why it's not wanting to show me the, where are you? Calcaneal tendon. There we go. Okay. Let's go down and look at that. So what he's referencing there in terms of the location, the Achilles tendon is a very long structure. The majority of Achilles tendon tears occur about 4 to 6 centimeters up from the calcaneus, so from the heel. So if we're looking at this from the side, we'll get that out of the way. If you measure, let me get rid of all these. I wish there was a setting to just like turn off these bursa. If you measure up from the calcaneus, the insertion of the tendon, about 4 to 6 centimeters, this is the area that's most prone to ruptures. We call it the watershed zone. So watershed in medicine means like poor blood flow. So it's an area of tissue. There's watershed zones in the brain. Certain bones like the scaphoid have areas that have less optimal blood flow. And so, pardon me. So in the Achilles, that area is about 4 to 6 centimeters up. That tends to be the weak spot where a tendon will tear. Also means there's not as great blood supply there when it comes to healing. And so this is, these repair techniques where they're drilling anchors into the bone, like these speed bridge banana sutures, all this kind of stuff. That's being done for these mid-portion ruptures because it's a little bit harder for that tissue to heal with less optimal blood supply. Kittle was saying that his tear was up higher. So basically more up in this like muscle tendon junction. And if he's understanding it correctly and portraying it correctly, that means there's better blood supply. They're not putting the anchors into the bone. Part of it is just because that procedure like isn't done for these proximal tears. But also when you're not drilling into the bone, you don't have to wait for those anchors to kind of incorporate into the bone. So it sounds positive. I mean, everything he's saying makes sense. Having a tear that's more up in this better blood supply area where you don't have to put in all the extra hardware, you're going to get better healing and blood flow, is all I think very positive. So that's what he's referencing. Is just the location of the tear. You can also, one thing we forget about but can certainly happen is people can get avulsion fractures where the calcaneus pulls and like the tendon avulses from the bone, where you get an x-ray and you see a big fracture piece hanging out. So the tendon's not actually torn. It's just that a big chunk of bone popped off the back of the heel. That's actually pretty good because you can just screw the bone back in and you don't have to do anything to the tendon. So that's what was going on with Kittle. Did that answer your question? Good. Did you have anything else specific about that? Let's see if Abby C543 is still here. Maybe. But yes, thank you for reminding me about that with Kittle. Okay. I think that's everything now. I don't think I forgot anything else. All right. Very good. Okay. Thanks, everybody. Take care. Have a great rest of the night.